As you would all be aware, there has been further reports of new infections linked to the Avalon cluster in New South Wales, and today we provide an update on the changes that will take place in South Australia as soon as possible, in line with trying to make sure that whilst we have a very Merry Christmas here in South Australia, we also have a very safe Christmas here in South Australia. First of all, can I say that as of midnight tonight, anybody who has been in the Greater Sydney area will be required to complete 14 days of suitable quarantine on arrival. They will need to have testing on arrival, plus on day 5 and on day 12. Anybody who has been on the northern beaches will not be able to come in. We have a hard border arrangement now with anybody who has been on the northern beaches. Anybody that has been in regional New South Wales will be required to have that testing, but they will not be required to isolate at this point. In a few moments' time, I will ask Professor Nicola Spurrier to go through in detail that testing arrangement and also the daily update in terms of our own coronavirus performance in South Australia. The Police Commissioner is here because we will immediately be setting up the border checkpoints at Oodlawira, Yamba, Wentworth and also Pinaroo, and there will be testing stations put at those 4 border checkpoints. They will be set up immediately and certainly will all be in place as of midnight tonight. We know this is going to significantly affect Christmas travel plans, so we don't take these decisions lightly. But in this instance, we believe that this is the best way that we can protect South Australia from any seeding into our state, especially as we lead up to Christmas. So I'll now ask Professor Nicola Spurrier to provide us with the daily update and further detail with regarding to the testing arrangements that we'll be putting in place for those people who continue to come in from New South Wales and also those people who have arrived from New South Wales over the past 3 days.
Thank you and good afternoon. So I'll just briefly give an update from the South Australian perspective. We have, as people know, international arrivals now in South Australia, so it's not unexpected that we will have some cases, and we do have 3 new cases for South Australia, but they're all overseas arrivals and they are all safely staying in our Medi hotel, so there's no public health risk at all. The cases are 1 woman in her 60s and 2 women in their 20s, and all of these are day 1 tests, so we're considering all of those people active cases. We had 1,900 tests yesterday, and my message to South Australians is with this increasing cluster in New South Wales, please really be mindful, and we're coming out of the parafill cluster. You really must be very mindful about getting tested. We still have our extensive testing in place across South Australia, and in addition, because of the continuing concern from New South Wales, I've spoken to the clinical director of SA Pathology, and we're putting our testing stations back up into some of those rural places or regional places to assist with testing people from New South Wales as they come across the road border. In addition, we have got SA Pathology now at the Adelaide Airport, and we will be requiring anybody flying in from New South Wales to get tested from this point. We've had that in place, the testing in place, but we haven't had many people having their tests done. But from this morning, with any flights coming in, they will be required to have that testing done. So yes, we have increasing concern about the situation in New South Wales. But just to reiterate, in terms of the localisation of this, it is mostly in the Northern Beaches local government area. And the New South Wales Public Health team are absolutely gold standard at doing their contact tracing, and I've been updated on a very regular basis and have spoken to them again this morning. And so I think we can feel, quietly positive about what is happening in New South Wales, but we do need to put things in place to make sure that South Australia remains safe, and thus, as the Premier has said, we have got increasing quarantine requirements for people coming in from New South Wales. What the reason for extending this is, as of course there are more numbers in the Northern Beaches local government area, and there's been more people, there's more chance that some of those people have been out whilst they're infectious to the greater Sydney area. And in fact, that's indeed what is now being seen. And the direction that South Australia put in place yesterday and that CDCB and SAPOL are working with has meant that we've extended that as things have changed to various suburbs within the greater Sydney area. But that's getting very difficult because things are changing so rapidly. So we were mindful of trying to stay ahead of the curve, and thus we've decided to make the whole of the greater Sydney area a high community transmission zone, which will require quarantine for people coming into our state. I just also wanted to point out that quarantine does mean quarantine, and whilst many people will be able to do home quarantine, it will need to be in a suitable place where there is a separate bathroom facility for those people in quarantine, and unfortunately it will mean that the family will not be able to get together at Christmas because we cannot take that risk. It is hopefully some relief, though, for people from South Australia who happen to be in New South Wales at the moment, so they will be able to come home. But obviously, it's going to be very disruptive for many people with their Christmas plans. And I do sympathise and empathise with those people. But we really need to put these plans in place if we're going to maintain the safety of South Australians. So I'm very happy to take any further questions.
So what about people who have already come in from New South Wales? What happens with them?
Yes, so since Friday and probably late Thursday, in fact, we have been picking up people and being able to find people who have come from the Northern Beaches, in fact, back until the 11th of December, because that was when the infectiousness period started in that particular area. And those people have been directed into quarantine if they've been in the Northern Beaches local government area. And so we've already had that process in place. But what we will be doing, because we have the travel declaration and we are able to contact people, we will be requiring anybody who's come in from other parts of New South Wales to have testing done, and that'll be in the previous 3 days. So if that happens to be you, we will be contacting you with an SMS, and please avail yourself to get that test done, because that's a way of absolutely checking that we're not bringing the disease into our state.
So if you've come in from the greater Western Sydney area as opposed to just the Northern Beaches, you're already here. You
Yes.
expect a call?
Absolutely. So we're wanting all of those people tested, please.
What about Adelaide Oval? We found out yesterday. What's the latest on the situation?
Yeah, so we are doing a number of things, and that included doing some wastewater testing. So we haven't had any positive wastewater testing from the Adelaide Oval, and that was specifically just for that oval area. We've also been working closely with the Adelaide Oval management, and the COVID safety improved over the 3 days of the Test cricket. And we also were obviously trying to chase up anybody through the Ticketek system, and also with security at the door, anybody that had been in the Northern Beaches, and indeed we had a number of people who would consider to be of concern in terms of transmission risk. Fortunately, they've all tested negative, but they remain in quarantine here in SA.
Have there been any more close contacts?
No, not that I've been made aware of, and of course, as I understand, the cricket may have finished now.
So testing if you arrive at Adelaide Airport from Sydney, what if you by road, same deal?
Yeah, so that's what we're trying. We've alerted SA Pathology last evening that we'll need to have some pop-up clinics. Now, we had extensive testing available in many of those regional areas, so we'll be reenacting and putting those back in place, along with the Police Commissioner putting their road checkpoints in place today.
How confident are you with these 3 new cases we won't see what we saw that spiked that previous lockdown?
Yeah, look, really good question. What I can tell you is that we have just done so much work on looking at every aspect of the Medi Hotel system, from the ventilation to the infection control, the cleaning regime, the way we have the security guards. We've got testing of our staff every 7 days, and in fact we're also very soon to be implementing the ability to do daily testing with our staff using saliva testing, which is much easier, and you can do a self-collection. So I am very confident. We have another a set of arrivals into South Australia, obviously, this week, and Pepper's Hotel is also going to be part of that. And I had an expert team walk through that hotel yesterday to absolutely check that all of the changes had been implemented, and I was reassured that that indeed is the case. So I think, look, there's always a risk when you have this nasty virus in your state, but I truly believe that we have gone above and beyond to make this as safe as possible for South Australians, because I can tell you, I personally do not want to go through another parafield cluster.
The three at Adelaide Oval, have you, as a precaution, notified all the people that were seated around that area, or what part of the oval were they in?
Yeah, so they indeed have tested negative, so they don't pose any further risk to people.
So no need for anyone that was there?
No. Mm-hmm.
And Professor, when you talk about, I know you sort of said there is some risk, but you did mention no public risk. Are you willing to stand by that if we do see another outbreak because of those 3 new cases?
Look, what I can say is this virus is highly transmissible, and we can only do what we can do as human beings to make it as safe as possible. And that is what our responsibility is from SAPOL, from SA Health. But as you can see in New South Wales, it is a difficult situation. Of course, I don't want to have this virus in the state any more than anybody else does. But not only do my team have a responsibility, but everybody in South Australia has a responsibility. So we can't all just think that SA Health and SAPOL will keep us safe and we can just go about our business. Everybody needs to get tested if they're sick. You don't go out to a Christmas party if you're feeling unwell. You do the right thing and you get tested. You continue to wash your hands and you stay 1.5 metres away from people that you don't know. So all of those things are still required here in this state. And of course, we have a level of restrictions that go across a range of businesses, including those QR readers. And my husband came home yesterday doing the shopping and he said, at the supermarket, I'm not sure everyone was using the QR reader as well as they should. So I really need to remind people all of those little things add up, and that's what keeps us safe. So yes, I'm very confident that we've done everything we can in terms of the Medi Hotel, but every South Australian has their part to play with this.
Cases continue to rise from the Avalon cluster in the Northern Beaches, and that the New South Wales health authorities can't get it under control. Will there be a hard border for the entire state?
Look, I think it's difficult to say at the moment, but I can reassure you that the Police Commissioner and I, we're working around the clock, we're monitoring the situation. I get very, very good intelligence and information from New South Wales Health, and we will do what we need to do at the right time.
Some other states moved much faster to shut their borders. Do you think we were right in waiting for today's news?
I think we've done this in a very measured way, and we've looked at the risk in terms of South Australia. So in fact, as soon as we knew that there were increasing problems back on Thursday, we had messaging at our airport, and SAPOL were asking people where they were coming from. So at this point, now that things have just moved along somewhat, we think that this is an appropriate set of measures.
So we don't need to follow Victoria's lead and put a hard border around Greater Sydney. The quarantine, in your views, okay at this stage?
I'm confident, and the reason is that if you look at the number of people, so Victoria has a very long border with New South Wales and also, of course, Queensland. So there are many, many more people. When we looked at the numbers, there are many more people travelling into those states than into South Australia. So we have a good way of doing the testing in South Australia. We've got a very good system already that we're very used to in terms of people making declarations as they come into our state, as they fill in that travel documentation. And we have a way of enforcing and lining up who's been tested and who hasn't. And SafePol has been excellent at making sure people are chased up in that way.
You made a mention of saying quarantine is quarantine. Is that the fear that given it's Christmas Day that there may be people who might be getting together, and how important is it that you stress people do not do that?
Yes, absolutely. When we say it's quarantine, we mean it's quarantine, and if we don't think it's safe in the situation that people have suggested, are they able to do X, Y, Z, then they'll be required to be in one of our hotels. So we'll make it very clear that if the families cannot separate and are not willing to, then it will be hotel quarantine.
Thank you very much.